Hello, everyone. Welcome to this lunchtime webinar, Increasing Cervical Screening for People with Disability. We're delighted to welcome you all here. These are the talking animated cervixes from the Screen Me campaign to increase awareness of cervical screening for people with disability. I'd like to acknowledge the country in which I'm on and which we're all on, of course. So I'd like to acknowledge the lands that we're all meeting on today. I'd like to pay respect and honour elders past and present and Aboriginal people who have joined us today from other lands across the country. Aboriginal people have suffered through colonisation, and it is a testament to the strength and kinship that we still have community today. Aboriginal people are the continuing custodians and traditional owners of this land, from the red dirt country of the centre to the green, lush river country and saltwater country surrounding us. And this is beautiful artwork by John Gilroy. So I'm Deborah Bateson. So I'm a professor at practice at the University of Sydney. I'm a medical doctor by background and formerly was medical director of family planning. It's my pleasure now to introduce Marianne O'Donovan. Over to you, Marianne.
Thanks, Deb. I'm Marianne O'Donovan. I'm the CEO at the Centre for Disability Studies, and I'm also Associate Professor at the University of Sydney. I have a brother with severe intellectual disability, and I do a lot of work with people with intellectual disability in research and in inclusive university space. And I will hand over to Emily.
Good afternoon, everyone. I'm Emily Wilson-Kay, and I've been the pleasure of having the job of project manager on this project and working with all the cervical screening advocates for the last year. And I'm here with...
Hi, everyone. I'm Edie. I'm just helping support this project as well.
Yeah. Thank you all for joining.
Excellent. And we're going to be meeting the cervical screening advocates with lived experience of disability who are going to share their experiences. You'll hear all from them soon. So we've got Sophie Geeves, who's from here in New South Wales, and we've got Lani Dean Lani's from Melbourne, and Emily Porter as well from Melbourne. So we look forward to introducing them to you. So these are our learning outcomes for the webinar today. So we're all going to understand that cervical cancer is one of the easiest cancers to prevent. We're going to understand that the cervical screening test now includes the new choice of taking your own self-swab, as well as you can also choose to have that sample taken by a doctor or nurse. We're going to understand about knowing your rights about cervical screening. We're going to think about what makes it difficult and what makes it easier for people with disability to have a cervical screening test. We're going to understand the role of the National Cancer Screening Register. And we're going to think about how supporters can help people with disability have cervical screening. And we're going to hear from the cervical screening advocates. And I'd just like to say, we know we've got a very mixed audience, so welcome to you all. That includes people with disability, it includes support people, family members, it includes doctors and nurses and government, so lots of people, so welcome to you all. And we're going to have plenty of time, as you'll see, for questions, because we do have a dedicated question and answer session at the end. So please do put all your questions in the Q&A box. We'll have time to answer those. We'll have a short break in the middle as well, about 1:25, so you can get a cup of tea and stretch your legs. We've got live captioning. Show captions is in the meeting controls at the bottom. So you can go to that and select your preferred language. And for Auslan, you click the interpretation icon. It looks like the world there on the toolbar. And if you can't see that, you can click on more if the icon isn't visible, and you select Auslan from the language list. So here's our agenda. So we're going to hear, first of all, about some background on cervical screening. We're going to then have that quick break I mentioned from 1:25 to about 1:30. And then, of course, we're going to hear from the cervical screening advocates and have the Q&A. Don't forget to put your questions in the Q&A box. So let's start off now about cervical screening. So as we've heard, cervical cancer is one of the easiest cancers to prevent. And Australia is actually predicted to be the first country to actually eliminate cervical cancer by as early as 2035. So how have we got to this situation? Well, it's because we were the first country to have a school-based human papillomavirus, HPV, I'll talk about it more in a minute, vaccine program. So we started this program vaccinating all girls aged 12 to 13. That started in 2007. And then we added boys in 2013. And in 2023, we just use a single dose of vaccine. So that's the first program. And the second program is the National Cervical Screening Program. And this changed. We used to do pap smears every 2 years, and now we do HPV or human papilloma virus testing every 5 years. It's much more accurate than the pap smears. But the key thing, of course, is if we're going to eliminate cervical cancer, we must make sure this is done equitably and we don't leave anyone behind, including people with disability. So let's have a look at this HPV, or the human papilloma virus. So we know that this is the cause of almost all cervical cancers. We know HPV infection of the cervix is very common. It's a very common infection. We know that an HPV, there's lots of different types of HPV. Over 80% of the population will be infected at some point in their life by HPV. So where is the cervix? Important to understand that. You can't see it from outside your body. It's inside your body. You can see on this little diagram here, the cervix is at the top of the vagina. It's a tube-like structure. It looks like a donut if you look at it end on, like those talking cervixes. And it's part of this canal that links the vagina to the uterus. So it's important to know where the cervix is. And what we know is that people who get an HPV infection of the cervix, mostly it goes away by itself. Almost everyone clears the virus, but in some cases, it can stay on in the cervix. It doesn't go away, and it can cause changes to the cells of the cervix. And sometimes, over a very long period of time, about 10 to 15 years, this could lead to cancer. So this is why we wanted to pick it up by screening, so we can stop cervical cancer from happening. So how do we prevent cervical cancer? I've already mentioned it's the HPV vaccination program of girls and boys aged 12 to 13 at school. But if you miss out at school, you can visit your GP and you can actually have what we call a catch-up vaccination up to the time you turn 26, so up to the age of 25. What about the cervical screening test? Here's Margot, who is in our Screen Me film, and she's just getting the letter about her cervical screening test. So it's for all women and people with a cervix who are aged 25 to 74 years of age. And as I mentioned, it happens every 5 years. You go and get it done every 5 years. Now, the test can be done in 2 ways. Firstly, it could be taken by the doctor or the nurse. Doctor or nurse takes a sample from the cervix, takes a sample of cells using this tool that you might have heard of called a speculum. That allows the doctor, this is Dr. Yvonne from Family Planning here in our resources, it allows the doctor or the nurse to see the cervix, so they can then take the sample with a soft brush. But now everyone who's eligible for cervical screening can actually choose, if they want to take the sample themselves from the vagina using a self-swab. It's a very simple swab. I think I can show it here. I have to see this. It just goes into the bottom part of the vagina and you turn it around about two or three times. Very simple to do. But we do know that for some people with disability, it can be hard to take it yourself. We hope we're going to change that, but it can be hard to hold that test tube and take it yourself. And sometimes people may just feel that they don't feel confident about taking it. So you can ask the doctor or nurse to help you take the sample from the vagina. But the key thing is this must only be from a trained healthcare provider. It's not appropriate at all for worker, for instance, to take that sample. This is a private, intimate examination, and it needs to be done by someone that understands the anatomy and understands what they're doing, of course. So very important, but useful to know it can be assisted. And these are some common questions about the cervical screening test. People ask, is self-collection as accurate as when the doctor or nurse does the test with the speculum? And the answer to that is yes. Both ways are very accurate. There's no difference, so that's good to know. People ask, does having the HPV detected, if the doctor or nurse tells me I've got HPV, does that mean I've got cancer? And the answer to this is no. Having HPV is very, very common. As I mentioned, most people clear it by themselves, but some don't, and the doctor or nurse will explain what you need to do to help stop cancer. And it's important to understand what happens after the test as well. And when you've done a test, whether it's self-collection or the doctor or nurse has taken it, your doctor or nurse will organise with you how you're going to get the results in about 2 to 3 weeks later. You may come back into the clinic for the results. They may sometimes organise to telephone you, or sometimes you might get a letter. But it's important to know that you will, obviously, it's important to get these results. Now, the results are going to be one of 3 types. Most people, over 90% of people, will have no HPV detected. We can look at these like a traffic light system. So almost over 90% have no HPV. And that means it's very safe to be tested again in another 5 years. So that's a good outcome, isn't it? But we know that some people, and it's a small number, but it could be any of us, of course, will actually have HPV types 16 or 18 detected. And these are the types which are most likely to, if we don't stop it, most likely to go on to cause cervical cancer. So what we want to do for people who've got this result is we refer them to a specialist for some additional tests, something called a colposcopy, where the specialist doctor or nurse has a close look at the cervix and sometimes takes a little sample of tissue as well, so we can work out what to do next to stop cervical cancer. And then there's another group of people in the middle where they have HPV detected, but it's not the types that are most likely to go on to cervical cancer. It's other types. And we know that for this group, it's safe for us to wait another year and check again in another year to see if the virus has gone away. It's really important that everyone knows their rights about cervical screening. This includes your right to have a cervical screening test. We don't want people to be denied that right, but also it is people's right to not have a screening test and make that informed decision. You have a right to see a female or a male doctor or nurse. You've got a right to ask for an interpreter. And importantly, a right to take a support person with you when you go into the consultation, or to go in on your own. And you might decide, a person with disability may decide that they want to take their support person in for some of the consultation, but not the part where they're taking the test, for instance. It's absolutely your right and your choice to decide whether to do the consultation on your own or take someone with you. It's also your right to say stop during the test. This is particularly important, especially if you're having a speculum examination. We know it can cause some discomfort, and we hear sometimes from people with disability that they have wanted to stop it, but they haven't been heard. And it is your right to say stop during the test if it's painful, if it's hurting, if you just don't want to carry on with it. So important to understand your rights. Let's have a look now about what makes cervical screening difficult for people with disability, though. Let's have a look at this and what can make it easier. So we know there can be difficulties at lots of different levels, including at the society level. With stigma and discrimination, we know that people with disability are less likely to have preventive health checks. So important that we make sure that they have this, all of you have this opportunity. There can be financial difficulties in going to see the doctor. We know that sometimes people with disability miss out on sex education at school. So again, not knowing about cervical screening is a barrier. And we know, very unfortunately, we do know from the Royal Commission and various other sources, of course, that there is widespread sexual abuse in institutions, and this can create a real barrier for people with trauma, to have a cervical screening test. It can be a real barrier. And this is why we really want people to know that you can have this alternative of doing a self-test without a speculum now. At an individual level, people with disabilities say that they sometimes have fears and can feel anxious, or a cervical screening test can be scary or frightening. And people may have past bad screening experiences. So again, important to know that you can have this alternative way now of doing it. Healthcare providers, we all, one myself, want to do the best we can for our patients, but sometimes we know that doctors and nurses can lack some skills and confidence in providing inclusive care for people with disability. And just to say, our project is also ensuring that we are doing training for doctors and nurses in trauma-informed care. There can be misassumptions about sexual activity by doctors and nurses, thinking that people with disability are not having consensual sex, which can mean that they're not offering cervical screening. There can be lots of competing health demands in a consultation, and sometimes we know that screening can go down the bottom of the list, of course, and sometimes the clinics themselves can be simply inaccessible. So what are the other things? Well, the health systems, there can be a lack of accessible invitation and invitations and reminders to have screening. We've talked about costs to see the doctor as well can be a barrier. And we know that families and support workers sometimes can, just meaning well, but can be overly protective, worrying, for instance, that the screening test will be too painful for someone, or thinking that it's not needed. So again, misassumptions about sexual activity. And sometimes we do know it's important that we know that families and support workers may also just not have the latest information on cervical screening, including being able to do the test yourself. So these are some of the barriers. So how can cervical screening be made easier? Well, at the clinic, it's important for the clinic to know about additional needs and supports, and letting the clinic know in advance. People can ask for longer or multiple appointments. And it's important to understand if the clinic has height adjustable tables and equipments and hoists if it's needed. And we do want to spread the word and ensure more clinics can provide these services in an inclusive way. And it's all about supporting choice as well, ensuring that the person with disability is able to speak for themselves and is supported to speak up. It's important about using accessible information. We have lots of accessible information, which we'll share with you, which is great. And delaying a cervical screening test is fine. It's okay. People can take time to decide. They may not be ready at this appointment and need to come back another time. People can choose how the test is done. Is it self-collected or clinician collected? And we want people to understand their rights. So let's now come to the National Cancer Screening Register. So let's understand the role of this National Cancer Screening Register. So the register is for cervical screening. It's also for bowel screening. And now it also includes lung screening, the latest new screening program in Australia. And it does hold data. It's a personal electronic record for people. It holds the data, but importantly, what it does is it sends letters as well, or SMS messages to screening participants. You can choose which way you want to get messages from the register. It sends the invitations to people to have their first screening test when they turn 25, and it sends those reminders for cervical screening as well. And doctors and nurses can look up the register to actually check whether someone's due or not for cervical screening. And it's got lots of privacy systems in place to make sure this data is safe. It also provides a safety net. If you don't go for follow-up, it will send a reminder. The register sends a reminder to you and will remind the doctor or nurse as well. And it helps monitor the program. So let's meet Margot now. Margot, as I mentioned, here's the actor playing Margot in the Screen Me campaign, the short film made by Bus Stop Film. She's a woman with lived experience of disability. She's going to turn 25 in 3 months' time, and she gets a letter about her first screening test in the post. She's finding it a bit difficult to understand, and she does actually talk to her sister, Augie. And Augie comes along to the clinic with her because they want to find out more about cervical screening. So Margot shows the letter to the doctor, and she says that she needs some help with cervical screening. So the doctor is able to go onto the register And she can check the register. And first of all, she finds that Margot's phone number is out of date and asks Margot if she's happy for her to update it. And Margot's actually very happy with that. So that's a good thing. And the doctor can see that Margot is, of course, due for that first cervical screening test. The doctor also lets Margot know, because she says she feels she needs a bit more help, that she could choose someone to help her take part in the National Cervical Screening Programme. This person is called a personal representative. Now, the key thing is no one must have a personal representative. So this is just for people that feel they want some administrative help, support with, for instance, helping read letters, for instance. It could be useful for other people, not just people with disability, of course, for people who don't speak English as their first language, who want someone to help translate the information on the register. So Margot decides she wants her sister to support her. She chooses Augie to be her personal representative. Augie is kind and listens to Margot. She understands what Margot wants. Margot says she feels nervous about the cervical screening test, and she's glad Augie will support her. The doctor gives Margot easy read information to take home, and she comes back 1 week later. And she decides to collect her own sample. So she has a self-collected test, and then when they come back for the results, the test shows no HPV. So she's delighted to know that she's got no HPV, and she needs to come back in 5 years. And so the doctor reminds Margot that she's going to get a letter in the mail to remind her about future cervical screening tests. But I must say, Margot is very pleased that Augie is going to get these letters too, because 5 years is a very long time off, and she's worried she'll forget. So the doctor gives Margot some helpful information. And these are the pamphlets. We're going to share all these links with you from the Screen Equal Research Project. They're easy read information about before, during, and after my screening test. This is marvellous Sarah Simmons from The Hunter, who is the star of all these resources. So let's just have a look now at the National Cancer Screening Register Participant Portal. So I've told you about the register, and this can be accessed through MyGov. You'll all be familiar with the MyGov app. It can link all your information together. You can look up your Medicare data. You can go look up your tax, for instance, as well as screening information. And the key thing, if you can link it to your cervical screening participation, it's used to manage participation in the National Cancer Cervical Screening Programme. And what you can do through this participant portal is to update personal details, like the phone number, update communication preferences, SMS or letters, for instance. You can look at your previous correspondence, and you can find out your screening status, including the date of the last cervical screening test and when your next cervical screening test is due. What it doesn't contain is your private health information. Only the doctor and nurse can tell you that. It's really important to know that. But for people who feel that they need support with accessing this accessing this information, or this administrative function, to be able to update your address, for instance, then you can actually you can choose to have a personal representative. So that's really important. So a personal representative plays an administrative role in supporting your screening participation. It's a trusted person. It could be a legal guardian, but it doesn't have to be. It can be a family member or a friend, someone who's there a long time in your life, because the next cervical screening test is 5 years away, of course. So someone you trust. And you can nominate someone yourself by requesting or calling or going online to the register. Or, for instance, you could ask your doctor to help you to nominate someone. So it's not for everyone, but it is useful for some people. So that's just to let you know about that function. And just to say, of course, supporters, of course, you all know this, are helping people make their own choices, to respect the rights of people with disability, be in control of their own lives. And just a bit of a reminder about the importance of the CHAP, for people with intellectual disability. It's the Comprehensive Health Assessment Programme, which is an evidence-based tool for conducting annual health assessments for people with intellectual disability. So we're going to have our 5-minute break now. Just all take a break. We'll come back we may say 4 minutes, because perhaps I talked a little bit longer this time. So we might say 4 minutes, but take your time. And we look forward to hearing from the screening advocates when you're all back with us then. See you soon. Thank you. Welcome back, everyone. I think we're probably ready to go. We can wait a few more seconds if people are just coming coming back after getting a cup of tea. And we're going to welcome the cervical screening advocates, which is fantastic. Okay, well, look, welcome back, everyone. It's really lovely to see you all and be together in this webinar. So just to introduce the Cervical Screening Advocates Program. So it's a program that's been funded. We're really delighted. This whole series is funded by the Department of Health, Disability and Aging. And the cervical screening program is where we brought 7 cervical screening advocates, and Sophie and Lani and Emily are going to tell you why they wanted to be cervical screening advocates. Brought them together from all across Australia, actually, including Tasmania and Victoria and South Australia and New South Wales, to share their experiences of cervical screening, and to learn more in more detail about cervical screening, about being an advocate. I must say, everyone's a fantastic advocate already, of course, but also take part in the co-design processes as well, including role plays. So now I'm actually going to hand over now to Sophie and to Lani, who are going to start off with their role play. So over to you both. Thank you.
So this is our role play.
It is.
Hey, Lani, how are you? You seem a bit quiet today. Everything okay?
Yeah, I just got a letter from the health department reminding me to go to do a cervical screening test. I know it's important, but honestly, I'm feeling a bit nervous about it.
Oh, I get that. What's worrying you the most?
Well, first of all, I can't see right. So just getting to the GP clinic on my own takes extra planning, like the booking a taxi, waiting, finding the right door, everything takes longer and it exhausting sometimes.
That makes total sense. It's not just as simple as popping in for an appointment.
Yeah, exactly. And they sent me one of those self-collection kits to do it at home, but I'm not confident. The instructions are on print, no audio, no large text. I don't even know if I do it right. What if I mess it up?
That's completely understandable, Lani. It's tricky for even sighted people. Maybe it'd be easier and less stressful to have the GP help you with it.
Yeah, that's what I'm thinking. I just want to make sure it's done properly, and I might call and ask if they can guide me through or book a longer appointment.
That's a great idea. You're taking care of your health, and that's what matters most. And if you like, I can go with you.
Thanks, Sophie. That actually makes me feel a lot better about it.
Thank you both. You're just such wonderful advocates. Thank you. And I'm just going to ask each of you, and maybe Lani, I'll start off with you, about why you decided to become a cervical screening advocate.
Yeah, hi everyone. My name is Lani. I'm joining you from Melbourne, and I'm a blind woman, and I originally from Vietnam, and I'm really happy to be here today. I want to share quickly why this project is meaningful to me. A little bit while ago, I was diagnosed with a cervical cancer. It was scary, but because it was found early, I was able to get treatment and I survived. Early screening truly saved my life. As someone who is blind from the migraine background, I know how hard it can be for our community to access screening. There's barriers, there's confusing, and sometimes people just don't know where to start. And that's why I want to be a screening advocate and I want to help others in the blind community and in migrant communities have the same chance I had, the chance to detect it early and to survive. I'm really grateful to be part of this project and I hope my experience can help make screening feel more accessible and less scary for others. And thank you so much for having me in this project.
Oh, thank you, Lani. It's thank you so much for your generosity in sharing your story and really helping others to, to take part in screening. We really, really appreciate you're a marvelous advocate. So thank you. And I'm going to hand to Sophie now. And Sophie, why did you decide to become a cervical screening advocate?
I decided to become a screening advocate because over the years when I've tried to access standardized health tests, regardless of whether you have a disability or not, it's become quite challenging, both physically but also dealing with attitudes and assumptions, with expecting that people with disability don't need to have the routine tests done. I was quite lucky with the cervical screening test that I have a very understanding and I guess forward-thinking GP, so I didn't necessarily have any issues with getting the cervical screening test done. In fact, she was the one that brought it to my attention and then assisted me with the self-collection test. But that hasn't always been my experience with other tests, and I've definitely been excluded and isolated from other important health tests, and I just really want to raise awareness of the importance of people with disability having access to appropriate healthcare like everyone.
No, thank you, Sophie. Your words are really powerful, I have to say, both of you. I mean, it's just so important for us to hear from you, to share your story as you are doing. And so, we've just been so, yeah, we're just very thankful for you, to you for joining the program, and thank you. So what we're going to do, and we're going to obviously keep you on here for answering questions, and please do put questions into the chat. And we're now going to switch to a short, just a few minute film with Emily Porter, another of our advocates, and then we'll get Emily online as well. So we'll just make this happen. Bear with us for 1 second. I'm glad I've got some help here. Now, we're going to go to the film now, I think. Oh, it's the one time. It's not working. Let's see. Do I just press on there? There we go.
Sorry, Deb, there's an issue with the sound.
Oh, that's no good. Sorry, well, I can hear it here. So, but luckily I've got Edie here who can help me out. Hello, Emily. We're going to look forward to seeing you on the film, but we want everyone to be able to hear you as well, of course.
Yeah, of course.
I'm glad I've got some technical assistance. Everyone's seeing my very busy calendar, I think, which is terrible. So it's fine.
No, we can't see anything, Deb, don't worry.
Everyone would go, oh no.
Oh, good.
Okay, well, hopefully this will work now. Or maybe it won't. Otherwise, I can come to Emily, of course, but let's just have one more go and see if we can get this film working. This is with Heather from Family Planning, who's been talking with Emily. We think it should work now, so fingers crossed.
Can you tell me about something that helps you at health appointments?
Actually, my mum helps me with my appointments.
So going to appointments with someone to support you is helpful?
Yeah, I always have my mum, which is really close to me.
You go with mum to health appointments. And how does mum and your doctors and nurses include you in your choices at health appointments?
You mean another way I choose?
How do you, when you go to appointments, is it important that the doctor or nurse talks to you or to your mum?
To me and to my mum. Yes.
So it's important you're included in decisions.
Yes.
Yeah. And Emily, sometimes people tell me that they feel a bit nervous or worried going to appointments. And so including a support person, sometimes people like to take something to help them feel a bit better. What do you like to take, or I should say, who do you like to take that you've got with you today to appointments to help you feel more comfortable?
Well, I do take my bubbies with me to keep me safe.
You take your Barbies with you to keep you safe. That's great. And how does taking your Barbies with you to appointments help you to feel? How does that help you feel safe?
The bubbies make me feel safe when I get a bit too nervous.
Having
So,
something from home.
yeah, I had to take a bubby with me because I like having my toys with me.
Thank you to Emily for that. And we're going to bring Emily on screen now. There you are, Emily. So thank you so much for sharing with us and sharing with Heather. And Emily, I was just going to ask you why you decided you wanted to be a cervical screening advocate.
When I had my cervical screening, I was put to sleep. I had a general anesthetic. I was having another procedure. I did the cervical screening at the same time. I want to be an advocate so that I can help other people like me.
Thank you so much for sharing. It means such a lot to people to hear from you, from all of you, just your experiences, and we really appreciate it. So thank you. I'm just going to continue with some of the slides now, just for 2 minutes, then I'll stop talking, and we're going to just get Marianne will help moderate our questions, and just will be 1 second.
Can you
Excellent. Okay, so just to highlight that there's plenty of resources. You can go on the Screen Me website. It's a microsite on the National Cervical Screening Program. Tells you all about this marvelous short film made by Bus Stop Films, which is an inclusive filmmaking company, and you can see Margie and Augie there. So just some take-home messages. So Australia wants to stop cervical cancer, and no one must be left behind, including people with disability. Self-collection can be a useful choice, or self-swab for people with disability, and you can get the doctor or nurse to help you if needed. Support people have an important role in helping people with disability to have a cervical screening test. People with disability may need extra support for follow-up after their test if they need to come back for another test or they need to see a specialist. And just understanding the personal representative function of the National Cancer Screening Register, it can be a useful tool for some people with disability. And do check out all the accessible resources. We'll send them all to you. So now it's time for questions and acknowledgements again to the Department of Health. Thank you. Thank you to our interpreters and, of course, all the team. We've met Edie and Emily, and there's Irina and Lauren. These are all our screening advocates. So we've got Tammy as well. You've met Sophie here, of course. We've got Tammy from WA. We've got Emily and you've seen here, Lani. We've got Polly from New South Wales and Sue from Western Australia and Carleen from country Victoria. So I'm going to stop screen sharing now and hand over to Marianne to help moderate some of the questions. I haven't been able to see them in the Q&A yet.
Thanks, Deb. Not a huge amount of questions coming through. There was a request for the slide deck to be shared afterwards, and I'm sure that wouldn't be a problem. But a wonderful discussion, Deb, and all of the screening advocates. Great to have you here today. And I'm wondering if everybody could share maybe what would you like health professionals to understand better about cervical screening for people with disability?
That's a great question. Maybe should we come to
Who would
one of
like
the
to start?
advocates? Yes.
Lani, your mic is off. Would you like to start? What message would you give to health professionals?
Yeah, my message to the health professional, because maybe I'm very lucky because I got a very good GP, and I know, I have a plan to move to the Tasmania before, but over there very hard for it, like to join with some program like that for the look after for health and for the women health and for the disability, the people like me. And that's why I changed my plan to move to the Melbourne, move back to Melbourne.
Okay.
And yeah, my message like I really hope some more people, not like the disability like me, have the more change and professional can maybe patient with us and get more time with us, because with the people like us, we can't see, but we feel like more sensitive than another person, and that's why I hope like and with the, like I said, with the migraine community and the disability, and I really want to help them feel confidence and feel like the open and like the trust to the health professional, and because it's safe for your life and it's safe for your family as well. When I got cervix cancer, and I really want to live because I got the two boys.
Mm.
Yes, that's very important with me. And I hope with this program and more people like me, and yeah, go for screening and, not step for your life, step for your family as well. Yeah.
Yeah, that's great, Lani. And I think that your sharing of your experience is a really important way to encourage more migrant women with disabilities to engage and to go for this screening. Sophie and Emily, would you have a message for health professionals that you want to share today?
I think my message would be that I think that there's always a way that the test can be done. So
Mm,
so don't assume that people with disability don't want to have the test done, or they don't need to have the test done. Certainly, and I think it makes it a lot easier when you have a health professional that's open to having those discussions, and maybe it doesn't look as straightforward or as simple as just doing it yourself or going for an appointment. But I think just allowing for those discussions to be had is really important as well.
that's wonderful. Yeah. So don't make assumptions and don't make decisions on behalf of
Yeah.
other people as well. Emily, is there anything that you'd like to add if you were to talk to health professionals about cervical screening for people with disability?
I don't really know anything.
Well, yeah, I think you made
Uh,
some great points earlier on, so he probably is, yeah, you've already made some great points, so you don't feel any pressure to answer extra questions either. There's no pressure. There's no problem. And Deb, from your point of view, you are a health professional, so how can health professionals better support people with disabilities, particularly anyone who's experienced trauma?
Yeah, so I think there is a focus now of greater understanding around the need for what we call trauma informed care, and that really is ensuring that someone who's experienced trauma in the past, whether it's sexual abuse, we know this can be very triggering for people, and sometimes I should say, we hope no one's being triggered here today. We know that you always need to reach out for help, so we need to ensure that that we're not re-triggering past traumas. And it really is about reflective listening, of course, all the things. There's different components to it, but again, it's that importance of talking to the person themselves as well. So, and I know there is it can be easy sometimes if a support worker is there with good intentions but is talking over the person with disability, to just speak to that person and move the consultation on. So it really is just having that real understanding about what it is to deliver that trauma-informed care, explaining the processes, how to take the sample, what's going to happen. That all-important thing about having an agreement before you do a procedure, for instance, about it's okay to say no, and what is there a way to do that. So sometimes I've talked to people about a hand gesture. They may just raise their hand if they want something to stop, if it's going to be uncomfortable. And I think the key thing with cervical screening, this is not something that has to be done today. It can always, you can come back another time when people have got more information. So I think it's all of those things together. The good thing is there's good training available now. In fact, we've got a webinar on the National Cervical Screening website. So we did some training with webinars with RACGP and Australian Practice Nurse Association. I think we got a link to that, and I think there's more and more awareness now about this need. And I think the other thing that's really important for doctors and nurses is to hear the voices of advocates, of people with that lived experience, like Emily and Sophie and Lani. And Emily, you've got your hand up.
Emily, would you like to come in?
Yes, I have something to tell you about. Is it if just like the way you guys are saying about a cancer and stuff can be a different cancer?
Yeah.
Because one of our two grandparents of ours has died with cancer. One of them had bowel cancer and breast cancer. And one of them died almost as his birthday, and I felt sorry for Lucy and stuff. But I really a bit more concerned about why people have to die on their birthdays.
Yeah, it's very sad when something like that happens. It makes it even extra sad. Losing somebody and losing on a special day can be really, really painful for everybody. And you raise a really good point as well, Emily, about there's all different types of cancer. And something that Deb and I were talking about is how do we advocate and learn from this project to advocate for better screening for other cancers as well. And I think we've been really, really lucky that we've had such strong advocates join this program. But Deb, do you think that there is a way to transfer some of the learning to other areas of cancer screening, or maybe other areas of the health system?
It's a really important question, and absolutely. I mean, we've been fortunate to get funding around cervical cancer, and that's part of wanting to ensure that we can eliminate this cancer, including for people with disabilities. So working with people with disability around cervix, but now, of course, we can absolutely transfer what we've learned. We've developed these resources, and they can be transferred for breast cancer, for instance, for bowel cancer, and now we've got lung cancer as well. And we've learned a lot, I think. So, and I think other health procedures as well. I think we really have to shine the spotlight on how people with disability do miss out. And one good thing that's going to happen as well with the government is that we are going to be able to, at the moment, we can't easily count the number of people with disability who have cervical screening. It's just not visible to us, but that will change with it's called a data linkage program. So it's going to, your data is very safe, but it does mean that the government, and then we can respond. It can highlight, that people with disability are not getting the screening tests that they need. So,
I totally agree with you, but I've been doing this a donation with kids not getting cancer.
Yeah, that's wonderful.
Oh, very good. Yeah, wonderful.
No, thank you for all your advocacy, Emily. It's really fantastic.
Yeah.
And maybe something for the panel to now share is how can or how should we now share this message broader than the people who are on the webinar today or have been on the webinars previously. So what are good ways that we can now share the message from today? And Lani in particular, how do we make sure that the message reaches migrant people with disability who have a cervix?
Yeah, when I share because with me, this project very important because it comes from my life experience. And that's why I take honor to change if I can share it. Like I share it in my LinkedIn, on my Facebook and all of my social life. And sometimes I put some on the team meeting in my company as well. And let more people know about that. And yeah, because with me, it doesn't matter. Maybe today you can see that it's a little bit message, but sometimes more times when you see that, you can see, oh, if you got something similar like that, and you can know where you can start. And that's the message I send because with me, I always said it's very important. It saved my life, and that's why I want to everyone know about that. Yeah.
Yeah, wonderful. Yeah, great. And Sophie and Emily, how do we share? How do we make sure we continue to share the message after the webinar?
I think, just talking to any of your connections, talking to service providers, talking to
Mm,
GPs, other health professionals, talking to really just anyone in your network, sharing it amongst social media, like Lani said, and yeah, just going from there.
great. Yeah. And I think we're hopeful we'll do some work with service providers next year, Deb.
Yes,
Yeah.
yes. It's very
Emily,
exciting.
any ideas for how we spread the word about the project and about cervical screening?
A cervical screening, as in cancer and stuff.
Yeah, how do we let more people know to go for the check?
Well, I think the best thing is if you ask the people to go to the hospital as soon as
Mm.
quickly, you weren't able to get cancer that way.
Yeah, so to go get your check done as soon as you can and yeah, keep on top of that. Yeah. Wonderful. Well, we've come up to the hour now. That was a really fantastic webinar. Thank you all for your sharing and your generosity in being here today. And Deb, thanks for leading off. I'll leave you with the last word.
Yeah, thank you. Well, look, I'd just like to thank absolutely everyone involved in this marvellous programme, but of course, particularly the cervical screening advocates who just do such a marvellous job in conveying. In fact, Emily, you just saying, yes, do get screened as quickly as you can to stop cancer. Obviously, you'll get those invitations, but I think it's just about doing this work to make sure that it is accessible as possible for everyone. But thank you so much for being marvellous advocates. And thank you, Marianne.